I am curious about how we can build a world where as many people as possible live long, healthy lives. My name is Sandro Galea. I serve as the Margaret C. Ryan Dean and the Kahn Professor of Public Health at the WashU School of Public Health.
I enjoyed your metaphor about the fish.
So I've long used the metaphor of a goldfish, and this is a metaphor that comes from many places, including something which David Foster Wallace spoke about in a commencement address, which is the goldfish does not quite appreciate what really is most important for its health. And of course, what's most important for the fish's health is the water it is in. And the metaphor, of course, is that we are like a little bit like the goldfish. We sometimes think that our health is determined primarily by the food we eat, the exercise we take, by the doctors we go to if we're sick. And all of that is, of course, true. But fundamentally, what really matters most for our health is the water in the bowl around us. And my intellectual engagement in public health has long been about the water, about the context where we live, the policies, the structures that shape the world around us.
Tell me more about that work.
So I've done work that is concerned with social structures, with built environments, with policies, with wealth and income, with social supports and norms, and how all of those ultimately affect the experiences we have and how that becomes health. My own work has in particular been around mental health and how these forces translate into our mental health.
Would you mind giving an example of maybe a particular study or something that you worked on that to show how that kind of relates to public health?
So we did quite a bit of work looking at the quality of the urban built environment and how that is associated with your mental health, particularly depression. So we did studies that showed, did a series of these studies in New York City and Detroit that showed that living in better, safer neighborhoods is associated with you having better mental health, less likely to have depression, even when you take into account all sorts of individual characteristics. So this is about where you live is greater than and above your own experiences and who you are. And that is a powerful argument for us as a society creating an environment where which generates health.
I read that you were born and grew up in Malta. I find it a fascinating place and it's beautiful. I've never been, but I would like to go. Did it relate to seeing kind of a juxtaposition of maybe an urban environment versus where you were raised?
Yes, I grew up in Malta, which is a small island in the Mediterranean between Southern Europe and North Africa. And it's a very small place. And it's a densely populated place. And it was really quite a beautiful place to grow up. The country went through quite a bit of social and economic turmoil in the 80s. I think that experience stays with one, the experience of going through social economic turmoil, the experience of immigration. And I immigrated to go to Canada, to go to university there. And then I eventually immigrated to the United States to come back to graduate school. So I immigrated twice in my career. I actually have a book about my reflections on immigration coming out later this year. So I think these are experiences that shape us. Certainly where I grew up shapes me. Certainly my immigration experience shapes me. And I think it gives me a real appreciation of how we as individual humans intersect with the world around us. It's hard to shake that when you have been through these different contexts and you see how they influence who you are and how you think. It becomes hard to avoid the fact that the world around us, where we live, where we work, where we play, the air we breathe, the food we eat, ultimately is what's shaping our health over and above everything else.
Would you mind sharing maybe one of those reflections or something related to what will be in your book?
Yeah, I can talk a little bit about the experience of alienness that comes with immigration. The book is actually called Alien Reflections on Being an Immigrant. And
Mhm.
no matter what, there are experiences of being other and being different that shape how you live and how you experience the world around you. And, I can think about, for example, the arriving in Canada when we first immigrated to Canada and seeing highways, these wide, roads that frankly did not exist in a small island like Malta where I grew up, and trying to grapple with how does one live in this context where even physical structure is alien. Of course, there is then living in a second language and learning how to speak in that language in a way that expresses your inner thoughts and engages with others who are more native speakers, which of course puts you in a different position than somebody who has always spoken the language. And these are all experiences of being different, and they pose challenges, but they're also strengths. They also are strengths. And I reflect on in the book because being able to see the world once removed gives you a lens, a perspective, a dispatch on the world around you. And I think you see things more sharply sometimes. And I think there's been several, particularly authors who had the immigration experience who described this. I don't see it as negative at all. It's just a particular feature of my own life experience. We all have life experiences. And for me, this feature, the feature of immigration, has been an important shaping force in my life.
Why did you decide to go into this field?
I was a physician originally. I'm trained as a doctor. I'm trained as an emergency doctor and a primary care doctor. And I practiced medicine in some pretty remote and rural parts of the world. I was in far northern Canada, this place like Somalia and Papua New Guinea. In those places, you really engage with health in a very tactile way, in that you have people who need your help as a doctor, and you're providing help right there in that moment. At the same time, I found those experiences dissatisfying in that I wanted to be part of a solution to create better health. I was seeing a lot of sick patients who I was helping as a doctor, and that was motivating and important. But I felt a little bit like the proverbial man inside a river, pulling people out of the river one by one, and never quite pausing to think of what's throwing them, who's throwing them in the river to begin with. And it was that that motivated me to think about public health, to think about how do I learn public health so I can think about being a part of an enterprise whose job it is to keep people from being in the river to begin with. And that is really, I think, what public health is about. It is about the science that understands the world around us so that we can prevent disease so people can live long, healthy lives. That's what we're doing as a discipline. And at WashU, as we're building a school of public health, that's what we want to do with the school of public health, and in particular with a focus on local community.
So, what are some of the major areas and a focus of the School of Public Health?
So as we're building a school of public health, we are being fairly open-minded about areas that we might want to take on and how we take them on. But we have a set of research networks that are focused on particular areas that we really want to advance, including one about food and agriculture, and really taking of food from agriculture all the way to nutrition, one about how you implement science, one area around how to communicate health, how to create new health communication, another area around how to think about environmental and planetary health, the full set. Another area of focus is how to think about the future of global health, health in global communities. All of these are areas that we see as important, that we want to encourage and move forward. And all of them represent areas that we have research networks in that are moving us forward.
So, speaking of the future of global health, that's one of the questions I wanted to ask you about of what you see in the future. And obviously, you'll have a lot of people researching that and looking at that conversation. But what are your thoughts on it?
Yeah, I think, public health is global health, and there is no distinction between the two. Global health simply means how do we take the mission that I talked about a second ago, and our mission is, again, to create longer, healthier lives for all and make sure that that extends to everybody in the global lens, in the global context. And I don't think that aspiration is ever going to go away, shouldn't go away. It would be sad if it went away. I want to make sure that that aspiration is something that we live by, and as such, we have a commitment to investing in health for global populations. So I think the future of global health is intertwined one with the future of public health. And as long as the world cares about preventing premature heart disease, as long as the world cares about making sure that we have safer neighborhoods, as long as the world cares about adolescents not having poor mental health, as long as the world cares about screening and prevention of cancer, the world is going to need public health and the world's going to need global health. So I feel like what we are doing is a shared universal aspiration, because who does not want to live a long, healthy life?
What are the areas, though, that you see that need the most attention? I mean, you mentioned those kind of 4 areas of focus, possibly for the School of Public Health, but what are the areas in global health that are most urgently needed to be addressed?
I think most of the areas that are going to need to be addressed are driven by demographic shifts. And that includes an aging population, that includes more urbanization, that includes gaps between urban and rural populations, and gaps between people with more and fewer assets in terms of health. That includes more population migration. That includes a changing global climate and global environment. And all these trends are going to be shaping everything else. So I think it's helpful to see the future of public health as emerging from the demographic forces changing the world around us, and as a result, changing our health in the world around us.
Are there any specific publications or projects that are happening at the School of Public Health that you'd like to share as kind of examples of what is happening and how WashU and the School of Public Health is engaging?
We've launched recently something we call the Purple Public Health Project, which is a
Mhm.
project that aims to create a conversation about public health that crosses partisan lines. It's not blue or red, but it's purple. That makes it clear that our aspirations for public health, the idea is to make sure that we extend the ideas to all people, regardless of their partisan affiliation, really leaning into the observation that everybody cares about public health.
Is there also engagement in more of the local area, like you said, being in the heart of the country that you see as different from when you were in Boston?
Our intention very much is to align with what the university's perspective on this is, to be in St. Louis for St. Louis, in the region for the region, in the country for the country, to really make it clear that our work aims to give back to the local community. And, I don't think it's that different than what I was doing in Boston, but that was obviously grounded in a different community. But here we are deeply committed to doing work that has consequence for local communities with their particular needs, and to advance local students, create pathways, and to create partnerships with local organizations who share our aspirations.
Have there been any fascinating aspects of what you do recently that you could share that you find particularly interesting?
I think what I found, what I will alight on, is how much eagerness there is in the community for a voice of public health in this community, in the St. Louis community, in the Missouri community, in the middle of the country. I think there is resonance with the idea and the purpose and the mission. And that really has been heartening and has been buoying of spirits, actually.
Thank you, Dean Galea, for taking the time to speak with me today.
Curious by Nature is a production of Newswise. More than 7,000 journalists get the Newswise wires. Visit newswise.com and find out how to spread your news today.